You know the drill. You go to the doctor, they draw some blood, and you go home. But have you ever really stopped to think about what happens next? What's the secret journey your sample takes after you've left the clinic? Well, today, we're pulling back the curtain on the hidden life of a lab test.
You'd think it's simple, right? You give a sample, you get a result. But oh, it's so much more than that. The journey in between those 2 points is this incredibly complex dance of science, safety, and communication that has a huge impact on your health. So let's get into it and see what's really going on. And to really get our heads around this whole process, we're going to look at it a little differently. Think of it like a 3-act play. It's got a beginning, a middle, and an end, and you, the patient, you're the star of the show.
Yeah, see, this isn't just a one-off event, it's a whole journey. And by breaking it down into these 3 acts, you're going to see exactly how your role and your healthcare team's role are woven together every single step of the way.
So what are our 3 acts? First, you've got the preparation, which we'll call the pre-test phase. Then comes the procedure, the intra-test phase. And it all wraps up with the revelation or the post-test phase. Let's walk through each one.
All right, Act 1, before the test. Now, you might be surprised to hear this, but honestly, the most critical part of this whole process often happens before you even roll up your sleeve.
This is where you really take center stage. You have what's called a patient's bill of rights, and that means you're not just some passive bystander here. You are the co-pilot in your own healthcare. You have the right to be informed, to give or refuse consent, and absolutely to get access to your own results.
And this is exactly why your active role is so vital. I mean, look at this list. Seemingly small things like being stressed out, a little dehydrated, or maybe not following those fasting instructions to the letter, they can all have a massive impact on your results. Accuracy doesn't just happen in some high-tech lab, it starts with you. And if you don't believe me, check out this quote from the source material. It's a real eye-opener. It's not the fancy equipment that's the most common source of error. It's communication. It all comes down to clear instructions and making sure you understand them. That's paramount. Okay, let's move on. Act 2, during the test. This is the part we all know, right? The needle, the swab, the whirring machine. But even right here, in this familiar moment, there's a whole world of unseen procedures happening to keep you safe and make sure that test is accurate. Behind that one simple blood draw is this meticulously choreographed routine. From intense infection control to making sure you're comfortable, every single step is designed to protect you and guarantee the integrity of that sample. The whole thing is built on a foundation of safety and precision. A real cornerstone of this whole process is something called standard precautions. It's a simple idea, but it's incredibly powerful. The rule is treat every sample as if it's infectious. Now, this isn't about you or making assumptions. It's about protecting everyone involved every single time, no exceptions. And now, for the grand finale, Act 3, after the test. Your part in the performance might be over, but your sample is just beginning its incredible journey through the lab. The results are about to tell their story. So what happens if a result isn't just a little off, but is potentially life-threatening? The lab has a kind of red alert protocol for what they call critical values. Those results get reported stat immediately to your provider, which triggers an urgent response to make sure you get the care you need right away. For most results, though, this final act is really about making sense of the data. It involves careful interpretation, maybe some counseling, and then making a decision together about what happens next. It's all about turning numbers on a page into meaningful information that you can actually use to manage your health. Okay, so we've seen the whole journey of a lab test from start to finish. But how do we actually know we can trust the results? Let's pull the curtain back just one more time and dig into the science of what makes the test accurate and reliable. First up, let's talk about sensitivity. The best way to think about it is like a giant fishing net. A test with high sensitivity is designed to be super wide to catch every single fish in the area. That means it's really good at identifying everyone who has the disease. The only catch is, sometimes a wide net might scoop up a few other things that aren't fish. And on the flip side, you've got specificity. Now, if sensitivity is a wide net, think of specificity as a key that's been perfectly cut to fit only one specific lock. A test with high specificity is fantastic at identifying people who don't have the disease, which means you get very, very few false alarms. So you see, the big challenge is always finding the right balance between these two. As you can see, there are 4 possible outcomes. A true positive and a true negative, that's what we want. But false positives, they can cause a ton of unnecessary anxiety. And false negatives,
Well, those can have really serious consequences.
Let's make this real with a concrete example. Here's some data from a new gene test for cystic fibrosis. Now look closely. We know that 77 people in this group actually have the gene. The test correctly identified 62 of them. So, how good is this test really?
Well, when you run the numbers, this gives the test a sensitivity of 80.5%. That's pretty good. It means it's catching the disease most of the time. But it's not perfect. It's missing almost 20% of cases. That means 15 people who actually have the gene would be told they don't, a false negative.
But what about its specificity? This is where the test is an absolute rock star. It correctly identified 341 out of the 346 people who don't have the gene. That's a specificity of 98.5%, which is fantastic. It means you can be very confident that if you get a negative result, it's a true negative. Very few false alarms.
So by understanding this whole hidden life of a lab test, you're not just a patient anymore. You're an informed partner in your own healthcare. The next time you're in that doctor's office, remember that the most important question isn't just, what's the result? It's, what does this result really mean for me? Thanks for joining me.